one of the common risk factors in today's era for post-operative endophthalmitis is clear corneal incision. For phacoemulsification, we are performing clear corneal incisions, and in these patients, there can be migration of organisms from the conjunctiva into the cornea if the wound is not properly constructed. And similarly, even in other cataract surgeries, when there is a scleral incision because of the overlying conjunctiva, if there has not been an adequate asepsis, or if the patient has some lurking conjunctival infection, it can immediately extend into the wound and thenceforth into the eye. So, incisions are very, very important. Incisions not only hold the wound in place, they also play a very large role in preventing infections. So, the other cause of acute postoperative endophthalmitis can be the intraocular lens itself. Intraocular lens, the biofilm, we call it a biofilm, which can be one of the risk factors for a secondary intraocular lens surgery resulting in acute postoperative endophthalmitis. So, always to remember here is any surgery in the eye is associated, any intraocular surgery associated with endophthalmitis. So, when you take the patient for a secondary intraocular lens, then it definitely increases the chances of endophthalmitis. Even after pars plana vitrectomy, it is believed to be one of the causes. So, when you say pars plana vitrectomy, again the incision is placed in the sclera below the conjunctiva, which renders it a riskful procedure. You can also have it following post-keratoplasty, and post-injection endophthalmitis usually presents within 5 days. So, when post-keratoplasty, the risk factor arises from the rim of the button that we are going to transplant. So, we take a donor cornea, and the rim of the donor cornea can usually harbor organisms, and that can result in post-keratoplasty endophthalmitis. And post-injection, one of the commonest injections that we are giving today is anti-vascular endothelial growth factor, and this has a very big use in so many conditions in the eye, for macular edema, for age-related macular degenerations, for vein occlusions when there is edema. So, for all these patients, or when there is neovascularization, so for all these patients, injections itself can be one of the risk factors, and in all such patients, it usually occurs within 5 days. So, this is just a picture to show you a typical acute postoperative endophthalmitis. So, what all are we going to look for? First thing is, you have to look for this conjunctival congestion. The conjunctival congestion is very, very typically present in all around the cornea. Then you can have, this is the hypopyon. Hypopyon is sterile exudation of white blood cells into the anterior chamber. So, what you are seeing here is a hypopyon which is about 2 to 3 millimeters in height, and this hypopyon indicates that there is a severe inflammation going on in the eye. Now, the cornea is completely hazy. You can see that the entire cornea is hardly, usually the cornea is clear and you can see the underlying iris and pupil, but in this case, you can't make out the iris very clearly, and this part of the eye is where the pupil is present, but you can hardly see it. So, this means that the anterior chamber is full of inflammatory cells and the cornea is edematous. So, this is one of the typical features of endophthalmitis. The moment you put the patient on the slit lamp, if you see this picture and if there is a history of surgery prior to the patient developing this, you know that you are dealing with a patient with endophthalmitis.